Good afternoon and welcome to our webinar this afternoon. We have the slide from our last webinar referencing the System Status Assessment webinar up here, but we will get into the correct content in just a moment. But before we get started, I'd like to remind everyone to mute your lines, and please remember to refrain from putting your phones on hold because we do hear that elevator music when that happens over the line. So if you could remember to do that, that would be great. So, of course, our overview for the local maternal child health assessment process, and we are on step 6, I'm very excited to say, for our process at this point. This is Julia Heaney from the Michigan Public Health Institute, and I'm joined in the room today by Trudy Esch and Robin Osborne from Michigan Department of Health and Human Services. Carrie too may be joining us at some point on the line as well, and we are all delighted to be here with you this afternoon to talk about step 6 of our assessment process. So as a reminder, this is where we're headed today. We are going to check in on where you are with your data collection process for the 3 assessments or 2 assessments that you're currently completing, and we'll talk in good detail about what step 6 looks like, provide some ideas for how to complete it, and talk about really the purpose and intent behind this piece of the assessment process. We'll also do a quick reminder on our SharePoint site and talk about deliverables and the feedback process, and of course have time for your questions now at really any time throughout the webinar. Here in the room we have our eyes open for questions that might be coming in during the webinar today, and we will respond to those as best we can as they come in. That a few more people joined the line since I first did our introduction, so I just want to mention one more time, if you could please remember to mute your phones, as well as remember to not put your phones on hold while we're on the webinar. And as another reminder, just as our other webinars have been, this webinar is currently being recorded and will be posted once we are complete today. A quick reminder of this broader process that we're in the midst of right now, where we've been and where we're going. So we start out by organizing for success and bringing our community partners together. Then we moved with our community partners into a visioning process where we articulated what we hope to see for women, infants, young children, and adolescents in our communities. We started the process of gathering and interpreting assessment information. Many of you are completing that process still right now and hopefully are getting toward the tail end of the assessment activities, where you're looking at indicators of population health, you're looking at indicators that tell you about behavior and tell you about the environment in which health happens within your communities, and also looking at indicators of how your systems are organized and programs and services are organized and functioning. Gathering assessment information that's really focused on hearing from the voices of members of your community, reaching out and making sure their voice is the assessment process. Some of you are also taking the additional optional step gathering information from your system partners about how the maternal child health system is functioning in your community. You're looking at how you approach assessment in general and planning. You're looking at surveillance. You're looking at policy. All of those system types of factors that can play a role and do play a substantial role in determining ultimately health behaviors and health outcomes for members of your community. So as we wrap up that process of gathering and interpreting assessment data, you've put together probably a long bulleted list of findings from your assessment. And in this next step of the process that we're going to dive into today, you're going to turn those findings into what Mobilizing for Action Through Planning Partnerships, NACCHO's MAP process, calls strategic issues. So it's a way of pulling together findings and turning them into a question that you're going to ask yourselves and your community partners about what do we do to take action around the things that we've identified that are important in our community. This step, we really move more into planning with developing goals and objectives and developing strategies and action plans. So as a reminder, you're familiar with this slide as well. The way we're thinking about this assessment is really built on the life course perspective, which has these two features. First, we're looking at the impact of things that happen early in our lives or intergenerationally on what our health status is later in our lives. We're also looking at the way our systems and services and social determinants ultimately influence health behaviors and health outcomes across the life course. So those two sorts of ideas that are built into the life course model are really inherent throughout the assessment and planning process that we're going through, that we really want to think about health as something that's determined through sort of this ecological way of thinking about things, this multi-layered or leveled way of thinking about things, and health is something that's determined not just based on what's happening with a person today, but what's happened with that person over the course of their life and even the lives of their parents. So a question that's come up a few times, and I'd like to share this question is not just coming up with the local health department assessment process, but also came up with the health assessment process. When we started off that process, one of the first questions we asked ourselves was, should this be a broad-based assessment where we're really looking at issues across maternal-child health? Anything could come up. There could be priorities that are part of Title V, priorities that aren't part of Title V, or should we have an assessment that's really Title V specific, that's focused on what the Title V block grant is focused on? And at the state level, the decision was made to complete a broad-based maternal-child health assessment, because at the state level, what they were thinking about is, well, we have partners can tackle things, we have other funding sources that could be used to tackle things, but also identify things that there are no funding sources for right now, but that we need to be on the lookout for funding sources are in the future. And we think it'll help us to have a process that's resulted in applying priorities that are broad in that way, that might be Title V related, might not be Title V related. So the state proceeded in that way. But truly, it was a tension sort of throughout the process of thinking about this as both informing Title V priorities and informing other non-Title V priorities. It's a complicated way of kind of thinking about an assessment that's happening under a particular funding stream. And I think we're noticing that tension also with some of the local health departments who've raised this really good question of, does the agency have to use LMCH funds on the priorities that are identified? And the answer to that question is no, don't. And rather, we'd like you to think about assessment in this kind of way. By the end of this step that we're on right now, step 6, you'll identify a set of strategic issues, questions that you have about particular areas of health within your community that are really priorities for yourself and for your community partners. Those priorities that you identify could potentially be addressed by Title V. They get addressed by other funding that you have access to or could pursue access to in the future, or they could be addressed by partners. They might be things that the health department isn't going to tackle right now, but you have a partner who is going to tackle it within your community. So we'd like you to think of the assessment in this broad-based kind of way, where some of the priorities we address by Title V, other priorities won't be. You may have things that you identify as issues that you and your partners decide you can't tackle that right now, or it's not a priority to tackle it right now, and they're kind of set in another bucket to the side. Is there anything you'd like to add to that?
The thing that I would like to add to that is that as you're identifying your strategic issues based on your MCH needs assessment, it is possible that what you're currently using your Title V funding on may not bubble up to be a strategic issue. And it may not bubble up because you have the Title V funding source there, and so that's meeting a gap need, and so therefore it didn't show up as a strategic issue. But if you took the funding source away, it likely would have come as a strategic issue. So aware of that sort of nuance, and as you go to write your next LMCH plan, which I'm talking about fiscal year 19, we'll just ask you to clarify that particular point. We'll ask questions slightly differently so that If you feel that it would be really detrimental to your agency not to use Title V funds in a way that was previously identified as a priority need, that you can explain what that priority need is. So other than that, I think you did a great job identifying how we really want you to think broadly about this, because there could be needs that you just don't even realize that you have, and they may be able to be addressed by another funding source, or maybe something that you have to put in a parking lot because you don't have the resources or time to address right now, but you might be able to find something in the future.
Thank you. I'm going to actually take a pause here because this has been a question that's come up. I'm going to unmute the phones and invite anyone online who has additional questions or points of clarification to let us know now, or you could submit your question through the chat box if you prefer. Everyone is unmuted on our end. Okay, I'm not hearing any questions bubble up right now, but if anything comes up to you later, we'll pause for questions a couple times throughout the rest of the webinar as well. Okay, so shifting to thinking a little bit about how things have been going so far, how your assessments have been going that you've been working on to date. We'd love to hear a little bit of your reflections, questions that you might have, successes you might have experienced. We'd just like to hear a little bit about how it's going and help with anything we might be able to help with today. So are there any questions?
That would be something. We're all
on the assessment process. So I just unmuted everyone's lines and am opening things up to questions. Or how things are going.
Lucy from Bay County. Hi. So I think we're a little bit behind. And I mean, our assessment process is moving forward, and I have this awesome intern who's been helping me with this. At the point right now where we're really interpreting what our data means as far as the spreadsheet and things, the data that we got from guys, and kind of comparing it with our own assessment we did. We conducted a focus group, did an intercept survey, and we attempted to do the community walls. I was really excited about the community walls, but we didn't get very much feedback. And I think part of the reason for that was because we could not have a person kind of staffing it, you know, and directing people towards it. So I think that was really kind of inhibitive for us. But we did get a few comments, and I haven't really gone through them individually, but from what I can tell, we got some good feedback from the comments we got, just not a lot of them. We tried out one here at our health department waiting room. We went up at our NEMSCA Head Start location, and then did one at the YMCA, trying to get different responses, in fact, from backgrounds. Only nothing from the Y. So that was a little disheartening. All right, but we did get some feedback, and then we did an intercept survey at a fair that we were at a safety day. So that was kind of cool. We got some good responses from some moms and families there. We're also doing the photo voice, and this is what we're really behind in, because we chose to use disposable cameras. A place that really developed 35mm film, so they had to be sent out, and it takes like 3 weeks to get that back. So but we're having our meeting for kind of presenting our findings from our assessment on the 26th to our coalition, but we will not have the photos and the information available for that meeting. So unfortunately, but we're still collecting it. You know, our families, we had 10 families that went out and did it. We actually made it a project. We worked with our homeschooling group here in Bay County, and so they kind of made it a project for their kids, for their homeschooling curriculum. So that's cool.
creative.
It'll be really
Yeah.
nice to see what comes of that, and we will include it. It just won't be ready. We won't get that done until July. So yeah.
Well, that's awesome. I'm really excited that you have used multiple methods to gather community input, and you've really engaged different types of groups that are going to be answering your questions about maternal child health from different perspectives. I think that's really common when, you put up the wall that you can't staff. It's harder to get comments up. One of the tricks that I've used, which to help a little bit, is if you yourself, when you put it up, if you write a couple comments on the wall, it can get people started, like feeling like they're not the first one to put something up. That can be a helpful.
We did that with the one we put up in our waiting room, but didn't do it with the other.
Yeah. I do think, though, it's harder when you can't have someone who's directing traffic that way and really encouraging people to use it. And the photo voice, I think that's a good lesson for everyone on the line around the disposable cameras and the amount of time, because you don't even think about that necessarily up front. How difficult it now, we're used to 1 hour photo and all of that, but those things are becoming of a past. So that's, I think, a good lesson for everybody. So thank you so much, Tracy, for sharing a little about where you are.
Opportunity.
Yeah. Would else like to share a little bit about where you are in your process?
Yeah, this is Ingham County Health Department.
Hi.
We have a project specialist that we brought on board to help us with this project, and so he's going to tell you a little bit about what we have done also.
Great.
Hey, Jill, how are you?
Hi, Emily.
Hi. So we also have some of the same issues as the previous person. I'm sorry I didn't catch their name, but get input for the input walls. In some places was a little bit challenged. So I think what helped us the most was having buy-in from the agency that we were working with. So Lansing Community College, we had a lot of input, but they also have a Facebook page, and they were able to announce it to everyone and told them, if you participate in this, you get your name put in a drawing for a gift card to Meyer. And then we also had a lot of participation for Low Health Center, which is just for adolescents. And adolescents, I'm a former teacher, so I know they like to talk a lot and say what's on their mind. So a lot of feedback from them. So I think I was able to go to those places and meet with people and form more of a relationship with them. So that really helped to get more feedback. I had about 5 input walls, but 2 of them were probably the most successful because we had more agency buy-in. And then this group, we did a place called Shared Pregnancy in Lansing. There were about 28 people there, which was a really high attendance for that day. So we were able to get some really good feedback on keeping moms and babies healthy in Lansing. So that was helpful too.
Well, that's and I think some more really good tips on the community input wall and some strategies for getting folks to feel comfortable writing on them. So thank you very much for sharing those strategies that you used with those 2 groups.
You're welcome.
Willing to share a little bit about your experience so far?
This is Danielle from Van Buren, Cass counties. How are you?
How are you, Danielle?
Good. Hey, we're doing fine and well with our assessments and how they're going. I actually have a question that I'm wondering if you guys or anyone else in the group could offer some suggestions for. We are planning to do the facilitated discussion for our systems assessment, and we'll have a group about 10 to 20 individuals, and I know we discussed having the computer there to, input the answers right into the Excel sheet then, but I'm wondering about best practices for the actual discussion period. So are you, splitting them into smaller groups, which I am considering because we have 2 counties, and then how are we recording the answers in a meaningful way that it can create discussion?
Those are both great suggestions. I will offer one suggestion off the top of my head and then open it up to the group to see what others think might be a good approach or approach they've used that they found success with. If I had a group of that size where I'm approaching 20 people, the way that I might think about when I pose a question is I ask people to think independently, silently, and alone about their own question, their own response to that question, and generate some ideas for themselves. Then ask them to talk in small groups, identify some themes from across the different members of that small group, and then I'd bring it back to the whole group to share those things that rose to the top in their discussions, and I would potentially post those on I'm losing the word for it, one of those large white pieces of paper that has a sticky backing on it.
Yeah.
Or a whiteboard, or even typing it and having it display on a screen so people can see what you're writing out to, so that you can check and make sure that you're capturing those ideas in the way that they intended them. And the reason that I use that is so that you can hear from everybody, because some people, are unlikely to speak up in a group of 20 people, even though they might have some good ideas that they'd like to bring forward and share. Ultimately, if you decide to use the piece of the process that is about the voting, one way to approach the voting piece of it is the way National Public Health Performance Standards recommends, is that everybody receives a piece of pieces of paper that represent the 5 options that are on that scale, and they hold them up to show where they believe the community falls on that particular question or indicator. And if there's consensus, then you kind of limit discussion. If there's a lot of disagreement, then you have some more broader, rich discussion until everyone sort of comes to consensus around where they think the community falls. Any questions about those ideas?
No, that's great. That's very helpful. Thank you.
Absolutely. What about others on the phone? What have you used to complete an assessment of this nature that's more discussion-based, to capture the ideas that people are putting forward and making sure you're getting accurate assessment of what the room thinks?
This is Barb from Kent County. Hi. I wanted to follow up with some of those questions around the systems and assessment. There are several questions, and I know your responses was you don't have to ask them all. But I'm wondering if there's a way deciding which ones to use or not. It just seemed really overwhelming to ask all the questions of a group, and in a time manner for good discussion. So do you have any guidance on that as to which questions? Yes.
Thanks. That's a really good question, and I can give sort of a general response. And if you want to give me a call and talk more specifically about different sections, then we can certainly do that. But I'll kind of give a broad response. If I had to choose, narrow down the questions within that set to just a couple, I would think of including a question that's more objective, that's like, what do we do in this area? Just because that kind of question people can respond to off the top of their heads. They can list things, they can name things, describe things that they do. And then I would ask a question that's a general, what do we think is really successful about this, and what do we think is not so successful about this? So I would just stick to broad levels of questions and first ask them to speak to the facts of their experience, and then what they think about their experience. And so those align with the questions that are kind of along the top, one of the top rows on the sheet. I don't have it in front of me, so I'm trying to picture it. I think they're along the top row of the sheet. And then I would think of those sub-questions that are under each area more as probes. So if you hear something that's really interesting, those questions could help toward asking some more detail about one thing or another. But if you don't have time for that, I think it's okay to stick that sort of higher level of questioning.
Okay.
At all?
Yes, that is very good. Thank you.
Okay, yeah, absolutely. Questions or feedback on approaches for the STEM assessment. Tricky one. Okay, thank you everyone for sharing your ideas, and thanks for asking your questions. I'm so excited to see what comes out of this process for you, and I'm so excited to hear all the great work that you're doing, and we're learning through it. So thank you for that teaser on what we can expect. expect when we get to read about what the work that you've done. So I'm put everyone back on mute, and we're into step 6. All about identifying strategic issues. So you might be asking yourself, what in the world is a strategic issue? It's certainly not a common term within our regular vocabulary or even really within public health, but it's something that was developed by the National Association of City and County Health Officials through the Mobilizing for Action through Planning and Partnerships process. Yeah, I hate acronyms, but you can see when you say something like that why we need them. So NACCHO's MAP process uses this term strategic issue, and I think it's really clever and creative, and I've seen communities use it really effectively. So I'm going to share this idea with this group and recommend that you give it a shot as part of this assessment process. So strategic issue, according to the MAP guide, strategic issues are fundamental policy choices or critical challenges that must be addressed in order for a community to achieve its vision. I think about strategic issues is kind of like this. So they're the barriers that block you from getting to your vision. They're the things that are standing in your way. So in this picture, we see all kinds of different barriers. We see the stoplights and the gates and the doors and the high walls and the metal and all of those things that block you from seeing what's on the other side of that wall and block you from getting there. So that's the way I think about strategic issues. They're the policies, the resources, the mindsets, the power dynamics, the access issues, the practices that get in the way of getting to your vision for your community. In order to get to strategic issues, the first step in that process is dive into your findings and really exploring what they're telling you. So you're going to have findings that are spread out across 3 tables in the template that we shared for this process. So in Table 7, you'll have your findings around a community input process. And then in Table 8, you'll have your findings around or the data that you explored that we sent or other data that you have available in your community. And then in Table 9, if you completed the system assessment, you'll have some findings around that. So across all of these findings, you will begin to think about what they tell you in terms of themes. So you'll pull findings together around a particular health outcome, and you'll use data from all 3 assessments. You might have noticed when you looked at your data that you have rates of breastfeeding that are really quite a bit lower than the rest of the state, and you're a little bit concerned about that and thinking that that's an opportunity for improvement. So starting with that idea about breastfeeding, you might look around the other sources of data that you collected and encountered and say, gosh, what else did we collect that tells us something about breastfeeding, for example? And go on those findings and think of them as a cluster that are telling you about a particular theme. One of the things I want to point out and encourage you to do as you're completing this process of identifying themes is to think about things from a life course perspective. So when you're thinking about a particular outcome, like for example, obesity in adulthood, you might think about breastfeeding as being something that's related to that outcome of obesity in adulthood. So it doesn't have to be all things that are related to that one point in a person's life, but they can be related to what happened earlier in a person's life as you're identifying themes. At that point is that when you are generating themes, you could have findings, those bullets from the list before, that fall into multiple themes. I think that's especially true around the system assessment and on some of those data points that are telling you more about social determinants of health. So a lack of access to transportation could have health impacts in a variety of different areas. So lack of access to transportation could be a finding that is related to multiple health outcomes. And it's completely fine to draw your findings together into themes in that way, where you're using findings multiple times to inform multiple themes. You identify your themes, and I'm going to walk through an example in just a second if this is feeling a little bit confusing. I know that this part of the process can feel a little bit complicated. Identifying themes, what you'll do is fill in table 10 in the tool that you have to guide the assessment process, and you'll identify the themes that you saw across your findings, and you'll enter them for each theme in that first box. And also note the finding that led you to identify that theme there in the second box. So you'll tell us your theme, you'll see, and you'll tell us the data that led you to identify that theme. First, this is a really great way to engage your partners in a needs assessment process, is really thinking about when you have all these findings and you're trying to sort them into themes, bringing your partners into that process can be really informative and can build a lot of buy-in around the themes that are ultimately identified if people feel like they had a chance to participate in that process in a meaningful way. And I'll give some examples for how to do that in just a minute. MCH tool, the tool to guide this process, you'll describe to us the process that you use to identify themes. This could be done in a lot of different ways, and we'll just be curious to know how you chose to do it, as well as the partners and community members and how they played a role in identifying those themes. So you'll tell us a little bit about your story for this process of identifying themes. So that steps were really just about identifying themes in your data. So looking across all the assessments and figuring out what themes emerge around particular health issues. The next step will be to name strategic issues. So remember, strategic issues are those most critical health issues that critical issues that if addressed would improve health. There's barriers that keep your community from your vision. Between a theme and a strategic issue is that strategic issues are written as questions that you have to answer as a community in order for a community to achieve its vision. And the reason that I think that this process is helpful, because certainly you could work from themes. You could just go with your themes and you could prioritize those themes. The thing that I like about this concept of a strategic issue and rephrasing that theme as a question is that I think it really is helpful for a group in making that step from data analysis to action planning, which is where we're at in this process right now. You've collected a lot of data, you've learned a lot about your community. In this step, you're saying, what does that mean? And then turning into, so what do we do? What can we do, should we do to get through this challenge we're seeing toward our vision for health in our community? Another point about strategic issues is that they're meant to be really broad, and the reason for that is that a broad question helps you develop innovative and strategic activities instead of relying on kind of what's familiar or what's the status quo. We want to open up this broad question to the community about what can we do around this issue that we're seeing in our data that we think is important to address within our community. What are your strategic issues identified? You'll list all of those in Table 11. And for each theme, you'll identify a strategic issue. So once you name your theme, you'll turn that into a question, which will be your strategic issue. And again, an example in just a second will be helpful. So we have an example for a theoretical community here on this table. And I'm going to go through this and kind of walk through how I would think about organizing this around one theme and one strategic issue. So imagine in Table 7, what my community noted as far as findings was that the mortality rate for adolescents is higher than the state average. Of course, that's about adolescents, and we noted for our community that there are 65.8 deaths per 100,000 individuals aged 15 to 19 years old, but at the state it's 50.7, and we think that that's concerning. It's something that stood out to us in our data, so we noted it as a finding. The suicide rate isn't something that's reported in the data table that we sent you, but if I saw for my community that the mortality rate for adolescents was higher than the state average at a level that I found concerning, my next step would be to say, well, mortality from what? Are we talking about car accidents, drug overdoses, accidental injuries? What is it that's causing this height of mortality for adolescents? And so I'm imagining that for my community, when we dove into those other pieces of data, what we found was that the suicide rate for people under 25 is higher than the state. And so we pulled that out as a finding as well, because we saw this concern about mortality rates for adolescents and wanted to figure out why, and figured out that the reason might be around suicide, that we're losing more of our kids to suicide than folks are in other parts of the state. Another piece of data that we're thinking might be relevant to the same sort of cluster of questions is that the percent of adolescents who smoke is higher than the state. And gosh, we're having a challenge with suicide, and we're seeing a mortality rate that we think might be driven by our suicide rate. We know that there can be stresses in adolescents that might also lead kids to be smoking as another way of coping with stress and anxiety. So we're not sure if that's accurate or not, but we think that it could be, so we're going to pull that into this set of what we're thinking of as related findings. So in, again, our fictitious community here, we also noted that in Table 8, we conducted some teen focus groups and had some findings that were also around social emotional health, behavioral health, concerns about stress, as well as tobacco and alcohol use. So we noted in those focus groups that we had that adolescents are feeling a little bit alone and disconnected in our community. They're feeling worried about the transition to adulthood. They talked a little bit about how they've noted some of their friends are using tobacco and alcohol, and they feel like it's just to cope with the stress that they're experiencing. And we also, when we were asking a little bit about, so do those kids reach out for help or for treatment, the adolescents in the group talked a little bit about stigma around mental health treatment. They said, they don't really go ask for help because that would be embarrassing. They don't really think that mental health professionals will be able to help them with the things that they're struggling with. And so we noted that as a finding as well. We also noted in those teen focus groups a couple strengths that we think might be related to the same underlying idea, that the adolescents are liking there's a job shadowing program at one of the high schools that adolescents think is really cool and help them feel more ready to take the next step in their lives. And the adolescents talked a lot about the parks and beaches as really an asset for promoting health, and they talked about them as a place where kids gather to do things that are fun and healthy and engaging. So they noted that, and so we thought maybe that's related to this broad idea about mental health in teens. Noted in our table 9 a couple things that might also be related. We talked about how we assess and monitor MCH status to identify and address problems. One of the things that we noted is that we're not regularly using mortality data for our community. We know that there's some challenges with it because it's 5-year moving averages, and so we haven't been looking at it that often and didn't realize that we were losing more teens than folks are in other parts of the state. And so we saw that as a gap. That we also have a community dashboard that our agencies really look at on a regular basis, and so if we have those things that emerge as challenges, we have a place that we can post them to bring awareness to the challenge and to bring focus around particular issues once they're identified. One about the essential service around linking individuals to health services. We noted that we don't have a lot of mental health services for adolescents who don't have serious and persistent mental illness, that we're really limited in that way as far as having services available. But we also, to strengthen that area, is that there was a small nonprofit that was recently formed in our community that's really focused on youth mental health, and so they might be a good partner to bring into our process here. So the idea is that these would be examples of findings that we're thinking could be related to the same underlying theme issue. So we're going to pull those all together into one place and come up with a theme. So about that table 10, we're going to name a theme in the second column. We're going to list all of those findings that we think are related to that underlying theme. So as you heard me talk through all those different ideas, all those different findings across those different tables, what might you name as a potential theme that draws those findings together into one kind of common idea. I'm unmuting everyone because I get your ideas on what that might be. Does this point to, do you think? I'll give you to think because I need a chance to think too. Type out your theme, you can do that as well. And it doesn't be perfect, it can just be kind of what you hear when you look across these types of findings.
For a phrase, a word, a sentence,
a sentence. Good question.
factor, impact, adolescent well-being.
Great.
And mental health needs more attention?
Adolescent mental health needs more attention. Great.
I think there is just a high level of stress that adolescents face every day.
The level of stress every day.
So it looks like, too, community involvement and being part of something.
And are looking for some community involvement and to be a part of something. That's great. Thank you so much for doing that with me. What I really wanted to illustrate by asking you to really think quickly on your feet there is just the point that there's a lot here, and it could be framed in a variety of different ways, and that's okay. The idea here is to have a conversation with your community partners and kind of come to a consensus of what this is telling you, not with the idea that you're going to include every single idea in your statement about the theme, but that you're going to have some discussion about, like, what does this mean? What is this telling us about our community? The other thing that I want to point out that we heard in that kind of listing of different ideas about what the themes might be is that some of what I was hearing could be really helpful in informing solutions. So one of the reasons it's so important to connect the theme with all of the data that informed it is that when you get to the step of figuring out what do we do about this, if you have a statement around we need to give more attention to adolescent mental health in our community, there's a bunch of stuff in here that can tell you where you might want to start in giving attention to adolescent mental health in the community. So it's really helpful, you know, to not lose track of those lines between what your themes are and the information that informed that theme, because there's all these things in here that are telling us about the stress adolescents are feeling on a day-to-day basis, or how they're looking for connections with adults or with their community or with other kids, that can help us think about if we're going to address teen suicide and try to reduce the teen suicide rate or improve adolescent mental health, where we might want to start in thinking about strategies and solutions. Okay. Thank you for hearing me for that. I really appreciate your participation. So as you are thinking about how to organize this, to have that conversation about what this all means, there's a couple different suggestions that you could consider in figuring out how to talk about it with partners. One of the ways that you could think about presenting this data is around the levels of the pyramid. So you could organize what you saw in terms of health outcomes, health behaviors, social determinants of health, direct and enabling services, and public health systems. That may be helpful, and bringing it to a group in this way might be helpful for them in thinking about what's the overall theme, and what are some of the things that we could do to address this particular challenge. It could also help them think about the relationships between more system and structural factors and outcomes that folks see. I think for some groups that's a real natural thing for them to think in those terms, and for other groups it's a little bit more of a challenge to think about how does this, do these broad services or systems things really relate to an outcome like suicide. So this sort of structure can be helpful just in doing that kind of organization of thinking. So step in the process is to identify strategic issues. So like we said, a strategic issue is reframing a theme in terms of a question. And so in this case, the example question that I brainstormed was, how can we make sure adolescents have the social and emotional support they need to overcome periods of anxiety and depression? And there's lots of other ways that you could frame this, but this is just an example of a way to frame a strategic issue that you can build off of or think about and as you're developing the questions that you're coming up with. So I'm talking about a particular phase of the life course. I'm pointing out adolescence in particular. I'm talking about social and emotional support. So I'm thinking about different levels of the pyramid in here. And I'm naming some health outcomes that I'm a little bit concerned about around anxiety and depression. So as you're thinking about how to put these together, try to tie some of those ideas together, but again, keep it broad enough that you're really opening the door to thinking outside of the boundaries that you might typically think of in terms of coming up with solutions. Some of the ways that this is done, this isn't a perfect depiction of it, but one of the ways that this kind of discussion can be organized, the way that MAP suggests doing it, is that you, for the assessments, you pull together the findings that were related to that assessment in particular. That's what's in these different boxes. So let's see. This data, and this is a focus group that was conducted, and this is the system assessment findings. So they're clustered together in this way. And what MAP is that you could do is look like sort of in front of on a board in front of you, organize those issues in this way, talk about what each of those findings are inside of those boxes, talk about what that means, and use that discussion around what it means to come up with your strategic issue or your question after you sort of verbally talked about what the theme might be. This is a different depiction of that same idea of how MAP might do it. So if you have a large wall, you would put your findings related to each of the assessments around a center piece of paper where you determine as a group what the strategic issue is that's telling you about. So you process like this with your groups if you'd like to in sorting through your data and then deciding what it means. Before I move to that slide, another thing to consider in this process is that you'll have lots of findings and you'll have potentially lots of strategic issues that emerge from your discussions. So this process that I just illustrated, you would be repeating for each of the different themes that you're seeing within your data. So I did a theme around adolescent mental health. You could have a theme around infant mortality. You could have a theme around healthy weight. You could have a theme around breastfeeding. You could have a theme around illness or injury. There could be lots of different things that you see that really come out of your data that are telling you something about your community, and you would repeat this kind of process for each of those themes that come out of your data, where you're saying we have an issue here around this topic. We're going to pull findings together and talk about them and figure out what does that mean in terms of a question that we need to answer for our community in order to get to our vision. So I'm going to pause there and ask for questions, because I know that hearing this process, when I heard about this process for the first time, I really had to give it some thought, and I don't think I really actually understood it until I did it, to be perfectly honest with you. When you're walking through it, it works and it makes sense. Hearing it, I know it can be a little confusing. So maybe folks on the phone who have gone through this process could share a little bit about what that looked like for them, or if you have any questions for me or for the group, please go ahead and bring them up now. Any questions about this process of going from data to strategic issues? For those that have used MAP and have done this before, how did you approach it? Any brave soul willing to share a little bit about their story? I will keep plugging along, and if you're willing to share later, that would be awesome. Okay. When I've completed this process with communities in the past, we've come up with a wide variety of number of strategic issues. For a broad-based community health assessment, of course, that's a larger number. We've had communities come up with 16, 20. The state had quite a large number when they finished their process. I should have looked up what it was exactly, but it was of 20, I'm pretty sure, that the state came up with as far as strategic issues. We've done this assessment process specific to MCH. It's been a smaller number of issues. We're in the realm of 8, 12, something like that. There's no correct number of strategic issues to come up with, but typically there are more strategic issues identified than you can prioritize to work on in the short term. So what that means is that the next step in this process has to be prioritization. You come up with 2 strategic issues, maybe you will want to tackle all of them. However, if you come up with more than you can tackle right at first, prioritization is certainly the next step. So when you're thinking about prioritization, again, we'd encourage you to think about priorities broadly. So these aren't only priorities for Title V, but also they're priorities that could be addressed otherwise by the health department, or you could pursue funding to address other priorities that come to the surface, or they could be priorities that are addressed by your partners. Or, of course, you could collaborate with your partners to address particular priorities. So again, think about the priorities broadly. They don't have to be things that fall under Title V. They could, and likely certainly will be, things that are outside of Title V as well. As you are thinking about prioritization, a couple tips to keep in mind. We'd encourage you again to engage your partners in the prioritization process. When we work with communities, always try to get to a number of priorities that we're agreeing upon up front. When these discussions start, everything is a priority, and that is so true. You know, the things that you identify, they'll all be important to health in your community. And prioritization can be a really painful and difficult process when you know everything really is important. At the same time, you know everything isn't doable all at once. So it's important to kind of come up with what's your number or what's your range of numbers that you think you can handle. We usually encourage communities to identify not more than 3 priorities unless they have a really robust partnership and a lot of capacity to take on a whole lot of things at once. 3 is a lot of priorities to work on through this process. So we'd encourage you to think in the 2 or 3 range. You can determine that for yourselves and with your partners. Also really encourage you to use a combination of voting and discussion. There is, both from experience and also from the research, good evidence to suggest that what people prioritize on their own initially and what they prioritize after they've discussed with colleagues what priorities should be, 2 answers are really very different. So that discussion piece is really important to build somewhere into the process versus only sticking to that voting and so forth. The voting is also really important, though, because it gives everyone a chance to communicate what they think are priorities, even if they're not willing to speak up in a group. You could consider setting criteria for prioritization. We have criteria often in terms of impact and feasibility. We'll talk about a way to lay that out. But you could consider other criteria as well that are important from the perspective of your community. You could think about alignment with initiatives going on in your community. There could be a variety of things that you might want to think about. And as part of the big picture of this, we ask you to think a little bit about the relationship to a Title V national or state performance measure. This will help you down the road when you're thinking about specifically your LMCH work, how these that you're working on through this assessment process might relate. So if you think back to example of what a strategic issue might look like, there are a lot of specific performance measures that can fit under this sort of way of defining what a strategic issue is and prioritizing. And we do that as an intentional and strategic way of coming up with priorities, that there are multiple ways that you can think about measuring under this issue, but the issue itself is not the measure. It's different than the measure and broader than the measure. We're not looking for like a one-is-to-one relationship between a Title V performance measure and a strategic issue, more thinking about how do the measures that we have for Title V, how could they relate to an issue like this? For example, we have adolescent well-child visits as one of the Title V performance measures. Adolescent well visits could certainly be related to an overall strategic issue like this, to the extent that pediatricians are checking in on anxiety and depression, are checking in on children's health in that way, providing referrals, connected with a referral network around adolescent mental health. All those types of things could be related to this particular issue and could be a relevant measure for a particular community. Okay, so prioritization strategies. There's so many different ways to come up with priorities, and it really just depends on what you think is going to work for you and your partners. One of the ways that we've done priorities before is we've taken all of the strategic issues and put them on sticky notes or cards that we can put on the wall. We've organized them along these two continuum. So we're thinking about the impact and the difficulty of addressing a particular issue here. So if we put an issue here in this quadrant, we're saying that that is an issue that has a lot of potential for impact on health within our community, and it wouldn't be that difficult to begin to tackle it. We have some ideas, we have some resources, we have some capacity in that area, and we think it's doable. We think of this quadrant as the golden quadrant. This is where you want to start. If you can identify strategic issues where you can have a lot of impact without a lot of difficulty, this is where you go. Second quadrant here, high impact and high difficulty, the next place to go. Kind of depends how high that difficulty level is. But this is, you can also have a high impact but it's going to be hard to get there. We think of this one as the challenging bucket. And the lower left-hand quadrant are where you put those strategic issues where you could think you could have a low impact, but it would also be not very difficult to implement. So these are our quick wins in this bucket, and those might be things that could be identified as priorities potentially, kind of depending on how low that impact is. Any that goes in the low impact, high difficulty quadrant are things that we let go of as things that we would want to make a priority. So the way that this is helpful is that it gets people to talk about both feasibility and importance, and to balance those two kind of competing interests out as they think about what to make a priority for tackling within their community. And it kind of points to a good starting point for coming up with priorities. Pause for a second to see if there's any questions about that particular method. Any questions about this approach? Has that used this? I had talkers today. I did forget.
Also chat in the chat box if you would rather not talk.
Okay, we'll check in again in a few minutes. So the next prioritization strategy is just your basic dot voting. With this kind of strategy, you give everyone a particular number of sticky dots to vote with, or of course you can do this electronically, which is nice because then it kind of takes care of all of the counting up for you. But if you're in a room together, it can be a really great visual too, and it gives a great opportunity for discussion. So one of the ways that you can do sticky dot voting that includes a discussion component is that before you start talking, you give everyone their sticky dots, and they put them on the strategic issues that they for themselves think are priorities. The way we've done this in the past is we read through the strategic issues that got no votes at all, and we ask if there's any concerns about those not having any votes and kind of address those. But usually what happens is those that got no votes, people are okay with letting go and putting them off to the side for the moment. Then we move over to the ones that got some votes, and we re-vote again. And we kind of use this iterative process of discussion and whittling down to get to the number of priorities that we can handle and manage within a community. So it's that combination of everyone's up and votes and says what they think, you have discussion about that, you vote again, and see if you can work your way toward consensus around a set of priorities. There's so many variations of sticky dot voting or other types of prioritization. Would anybody be willing to share your experience with prioritizing either through MAP or any other sort of prioritization exercise that you've been through that you thought was helpful for a group? Experience with prioritization.
Share that in a previous job, we did this kind of sticky dot prioritization with a very large group. It was a couple of hundred people that were in the room, and we had to walk around a very large sort of auditorium conference room to put the sticky dots on there. And what was really great with such a large group to do prioritization is that you could really see where people's issues bubbled up. And it was really nice then to validate that, and it was a powerful tool to see where all the dots landed.
Yeah, absolutely. Thank you, Judy. Does anybody else have an experience with prioritization they could share?
This seems weighty with oh, there's someone that wanted to go over. Go ahead.
Oh,
I just wanted to mention we've not been through the MAP process yet, but we did a sticky dot presentation with a strategic planning session for another coalition we ran. And one thing that I found was helpful with people is they had deciding, between what was most important to them. We really stressed that we were, looking to prioritize the things to address immediately, and ensuring people that all of the issues are important. But if it helps people to think about what might want to address immediately, and then other issues that they're saying, oh, this is important, I don't want to let this go, then certainly in the future those are issues that we would focus on once we've sort of tackled whatever we thought were most important immediately.
Yeah, I think that is a really common challenge in prioritization of helping people make those difficult choices where, or more things than you can choose are truly important. And so having those strategies in your back pocket of, like you suggested, what's the most immediate needs for our community, I think is really important. So thank you so much for sharing that tip.
It's from Oakland, and we use the process for our community health assessment as well as prioritizing our strategies with them. And then we also use it for strategic planning. The most difficult part was when you only give them so many dots. People they find it very difficult to really prioritize what they want to use those little dots for. The other thing is we did it where we had color-coordinated dots, so we had red, green, and yellow-green, and they had prioritized. Then after we divided it down and we got it down to a certain number, then we did prioritizing with the dots. It worked out really nice. That came out too as well.
So it sounds like you use kind of an iterative process. When you said color-coded, was that like a stoplight sort of color coding, like high, medium, low, and you sort it out?
Absolutely. Yeah.
Okay.
So red was most urgent, and then yellow was, and green was the least likely that you would want to use, kind of. So basically, you were prioritizing which ones you thought we needed to do first. So but once we got it down to a smaller set, then we took that smaller set and did the dot system with the priority in there, and helped us narrow it down because we just had way too many to focus on.
Yeah.
So it worked out pretty good, actually.
Thank you for sharing that. I think that's a cool strategy too, of kind of stoplighting the cards or the ideas, and using that to help narrow it down and getting around that idea of I only have 3 dots, I have to use them. Other experiences around prioritization that you'd be willing to share?
Conley from and at our most rural health network meeting, where there's a lot of community partners, health organizations, as well as stakeholders in the process. We've had a few meetings to determine the areas that we want to focus on. The last meeting we had, we actually, to the 9 questions, we took all of the different priority areas and used Kahoot, which is online, interactive. You can use it for games and surveys or things that it's kind of you do it on your smartphone. They got a code, and they all did it online, and you could see the results on the screen. So they could see the rankings 1 through 4, like a Family Feud online. It was interactive, and then the next meeting we presented them with the score, each category of highest priority, how they scored out.
Awesome. So we will that's a great idea. We'll actually post a link to Kahoot so that folks can see it. That would be a good tool also for doing your system assessment. If you are doing the scoring, that would be a helpful way to do it for that too. So yeah, great idea. Thanks for sharing that.
Yeah, it's free. It was very interactive. I think it lit up the meeting, and then a lot of discussion went along with it as we talked about why someone ranked something the way they did.
how did you feel like that discussion influenced the process?
A lot of people thinking about other things, other areas that, you know, as community partners, whether it's a health system or a school or, you know, RESDs, you know, many different people that are points to our maternal child population at various levels, really got them thinking about what I do to help what this agency does so we're not competing while working together towards the same goal to improve health.
So you're seeing some kind of benefits in addition to kind of enriching people's thinking about where priorities might lie.
Yeah, well.
Awesome. So even just identifying some wins that are possible with some of these things is a great outcome of just having that chance to discuss key issues for a community. So thank you so much for sharing. Those were really great ideas and suggestions, and I appreciate your willingness to share them with the group. Another prioritization strategy that I've used in some cases with some communities that I think is a little bit, when folks have a lot of ideas about what makes a priority, this can be a helpful way to kind of whittle things down, as long as the group isn't too married to the scores that you come out with in the end. So you can have basically a survey that everyone takes around each of the strategic issues where they ask a series of questions that align with potential criteria. So will addressing this issue have an impact across the life course? Can we leverage existing resources? Is this important to our customers? Do we have the will to tackle this issue? And so they're offering yes or no to each of these, and then you're adding up your yeses to get to a score from 0 to 4 for each of the strategic issues. If you have a lot of strategic issues, it's better to use a scale than a yes or no. So you're having kind of another level of maybe 1 to 4 in what people are scoring for each of these, so that you have more variability in your total score that you come up with in the end. So this is it's a little bit more of a resource-intensive way of doing it, to go through the process of coming up with what are the criteria we need to use for prioritization, going through the process of completing a survey, getting the scores, and then having a discussion around what those scores mean and look like for you as a community. So this is an option if you kind of have the will and participation to kind of go through each of those steps in this sort of a process. Once you come up with your priority strategic issues, you'll tell us about what you did in the context of the LMCH tool. You'll tell us about what method you used to prioritize in question 17, and in question 18, you'll tell us about the 3 to 5 issues that you're going to select to address. For your priority strategic issues, we have a table or a series of tables in the tool that provide space to document your conversation about the strategic issue you prioritize. You might not have answers to every single one of these questions, and that's okay. This is just to kind of prompt you to remember different aspects of how that selection process was informed by discussion. Being able to document this information is really helpful when you get to the next step around identifying goals and strategies, because some of that will come up in the discussion around what are your priorities. People will talk about existing programs and resources, things that were successful in the past that could be built off of, things like that, and you just don't want to lose it as you move forward. You want to be able to reference back to those things that people mentioned in this process that will be helpful as you're thinking about what are our goals and what strategies do we want to use to tackle those. Okay. So I'd like to just revisit this kind of concept broadly and ask the group how you've used data to identify strategic issues, and we've covered that question about what, I forgot the questions that I put in my own PowerPoint presentation. So we have talked about prioritization strategies. If there are any others that you'd like to share, please go ahead, but would anybody be willing to speak to the process that you've used within your community to identify health priorities or strategic issues that you've determined that you need to tackle? How have you used data to come up with strategic issues within your community? Or you could also type a response in the box. Data to figure out what you're going to do is really challenging. It's something that I think health departments are so innovative with and so creative and come up with all kinds of ideas to make this a process that works for them in their community. So this is only one way of doing it, the way that NACCHO kind of lays out, but there's other ways, and any lessons that you've learned or things that you've tried that you'd like to share, I know would be helpful to your colleagues. You told me lots of good things about the second question already, and I really, really appreciate what you were willing to share there. Okay, so having kind of wrapped up the step 6 information, we have a couple other notes to share. The SharePoint site is a great resource for the slides. All the slides are posted there. If you just want to see the slides but don't want to watch the whole recording, you can do that. You can pull out the webinar recordings and share them with someone who wasn't able to make it, or see uses of it again if you'd like to do that. If you need the tool itself, that's there on the SharePoint site. There are lots of additional resources that you can find on the site as well on different parts of this process. If you're not sure who to contact, all of our contact information is on the SharePoint site as well. So you can just click on that link and it'll take you right to the site. So use that resource, it's there for you. If you need any help with any part of the process, your team here at MPHI is available to you for technical assistance, as are Trudy and Robin. They are always excited to hear from you and willing to help. Some next steps. So we have some deliverables that are coming up due on June 23rd. So we'll be expecting to see the LMCH tool steps 4 and 5, and I have the specific questions and tables that we'll be looking at as part of this next review. Sessions 10, 11, 12, 13 and D, 14A through C. If you completed the systems assessment, we wouldn't expect to see that if you didn't. Then 7 and 8 would be completed, and Table 9 would be, again, completed if you completed the systems assessment or part of it. We'd also like you to send us the status assessment workbook, only if you added additional data to that workbook. If you added additional data but you didn't put it in the workbook, that's fine too. If you could send it to us, it'll really help us in understanding the findings that you came up with. Have that data to reference back to. So if you could send that, that would be really helpful. Also, if you could send the system assessment spreadsheet if you completed all or part of that assessment, that will help us as well in looking at the findings.
I add that if you decide, we made that last question 14 and Table 9 optional, and we hope that you tried to do part of that systems assessment. But if for some reason you didn't have the time or the resources to do that, you would just indicate that on the, on question 14 and just say, we elected not to do this at this time, so that we're aware that you didn't just skip over it.
Thank you. I appreciate that. So we're asking that you submit by June 23rd and email your submissions to Lauren. Again, just like with all the other steps, if you need a couple more weeks, if you're waiting for your meeting to come up or anything of that nature, just let us know. And again, the deadlines are really to just help the process move forward and to kind of give you targets to work toward, but they're not set in stone. There's flexibility there. So let us know if you need to access that flexibility. Check your calendars to make sure you have that next webinar on July 13th from 1 to 3 on your calendar, and we will look forward to speaking with you hopefully before then, but if not, on that date on the next webinar that we have coming up. After you submit your steps 4 and 5 pieces of the tool, we will be completing those feedback forms again, and we just want to remind you that those feedback forms are really just meant to aid in your assessment process, either this one or next time you do an assessment. We're just kind of giving you some of our reflections and observations on what you did really well and what you might want to think about in the future. As we close today, I'm going to unmute the lines again and ask if there are any questions.
So I had to step out for a minute, and I came in at the end. So if I just need you to re-clarify for me on your slide that it says, does my agency have to use local maternal health funds on the priorities that are identified? And you, if I got it correctly, you said no, but you may use local priorities. Is that correct?
So what we said was that what are your priorities? Those might be things that Title V pays for. They might be things that other health department funds pay for or your community partners work on. There's a wide variety of ways that priorities could potentially be addressed. We don't need to narrow it down or think about it only in the context of what Title V will do. And we recognize that Title V might be paying for something that is providing a critical service within your community right now, which is why something like immunizations, for example, didn't rise to the surface as a priority, because you are meeting that need right now. So we recognize that as well. So it's a complicated process, but we don't want anyone to think that your Title V funds must be used to meet the priorities that are identified. That's not the intention.
Yep. Thanks.
Yeah, absolutely. Questions? Okay, thank you everyone for your participation today. I really appreciate it, and thanks for those of you who shared a little bit about your story. That was really great to hear from you, so thank you for that. Please have a wonderful and safe afternoon, and we'll look forward to speaking with you in July, if not sooner.